Deciphering Baby Grunts, Understanding Infant Distress. Welcome to Baby Talk, your trusted source for unraveling the secrets of infant communication. In this comprehensive guide, we will explore the intriguing world of baby grunts and what they might reveal about your baby's well-being. From understanding infant distress signals to recognizing breathing issues, we've got you covered. So, let's dive deep into this vital aspect of newborn care. Section 1. Deciphering Infant Distress. Infant distress is your baby's way of communicating that something isn't quite right. As a parent, understanding these early signals is invaluable for providing the right care and attention. Babies can't use words to convey their needs, so they rely on nonverbal cues, such as crying, grunting, and body language. In this section, we'll guide you through recognizing those early signals that your baby might be in distress. Crying, the universal language. Crying is perhaps the most common and unmistakable sign of infant distress. It's your baby's way of saying, "I need something." However, crying can be caused by a variety of factors, including hunger, discomfort, tiredness, or illness. Understanding the nuances of your baby's cries can take time and observation, but it's a valuable skill for any parent. One of the first things to check when your baby starts crying is their basic needs. Ensure they are fed, clean, a fresh diaper goes a long way, and well rested. If these needs are met, and your baby is still crying, it's time to explore other possible causes of distress. Non-crying distress signals. Beyond crying, infants communicate through a variety of nonverbal cues. These cues can include grunting. As mentioned in the video, grunting is a notable distress signal. It often signifies discomfort or difficulty in breathing, which we will explore in more detail shortly. Frowning. A furrowed brow or facial expressions indicating discomfort or pain. Arching back. If your baby arches their back, it may suggest digestive discomfort or reflux. Clutching hands and feet. Babies may clench their fists and curl their toes when they are in distress. Turning away. Babies might turn their heads away or push away from the breast or bottle if they are full or experiencing discomfort. Lack of interest. A sudden loss of interest in toys, people, or their surroundings can be a sign of distress. Section 2. Grunting as a distress signal. Grunting is a distinctive sound that many parents notice their babies making. It often sounds like a soft, guttural noise and may be accompanied by facial expressions indicating discomfort. Grunting is a noisy breathing sound that can indicate your baby is trying to get more air into their lungs. When your baby grunts, it might resemble snoring or singing, but it's essential to recognize that it's their way of letting you know something isn't quite right. Grunting is often an attempt to help your baby breathe more effectively, and it could be a sign of several underlying issues. Respiratory issues. Grunting can sometimes be linked to respiratory problems, especially in newborns. Infants have underdeveloped respiratory systems, making them more susceptible to breathing issues. When your baby grunts persistently, it could be a sign that they are struggling to breathe properly. Causes of grunting in babies. Nasal congestion. A common reason for grunting is nasal congestion. If your baby's nose is stuffy or blocked, they may grunt as they try to breathe through their noses. This can be more pronounced when they are lying down. Gastroesophageal reflux, GERD. Babies with GERD might grunt due to discomfort caused by acid reflux. This condition can lead to the regurgitation of stomach contents into the esophagus, causing discomfort and grunting. Lung issues. Grunting can also indicate potential lung problems. Premature babies, in particular, may struggle with lung development, and grunting can be a sign of respiratory distress syndrome. Infection. In some cases, grunting might be a response to an infection, such as a respiratory tract infection. It's crucial to monitor your baby for other symptoms like fever, cough, or difficulty in feeding. Heart issues. In rare cases, grunting can be a sign of a heart problem. If your baby's grunting is accompanied by symptoms such as rapid breathing, blue lips, or a pale appearance, it's essential to seek immediate medical attention. Section 3. Breathing problems and distress. Breathing problems can be a significant source of distress for infants. Babies, especially premature or newborns with underdeveloped respiratory systems, might encounter difficulties in breathing effectively. Retractions. One concerning sign that often accompanies grunting is retractions. These are unusual movements where your baby's chest muscles pull the skin around their bones with each breath. When your baby struggles to breathe, the body tries to compensate by using these muscles to draw more air into the lungs, which results in visible retractions. Apnea. Another alarming condition is apnea, where your baby pauses breathing for 15 to 20 seconds before resuming. Apnea can be a severe issue and requires immediate medical attention. If your baby experiences apnea, it's vital to contact your healthcare provider as soon as possible. The importance of monitoring. Monitoring your baby's breathing patterns and looking for signs of distress is essential. Infants are at a higher risk of respiratory issues due to their small airways, immature respiratory muscles, and reduced lung capacity. By being vigilant and responsive to your baby's breathing, you can provide timely assistance when needed. Section 4. Recognizing cyanosis and jaundice. Infant distress isn't limited to breathing problems or discomfort. It can also manifest in physical changes to your baby's skin, including cyanosis and jaundice. Cyanosis. Cyanosis is a condition where your baby's skin takes on a bluish hue, typically appearing around the lips, chest, and stomach. This discoloration occurs when there is a lack of oxygen in the blood or poor circulation. It is a critical sign that your baby is not getting enough oxygen, and immediate medical attention is necessary. Cyanosis can result from various factors, such as respiratory issues, heart problems, or circulatory problems. Regardless of the cause, it's a sign that your baby is in distress and requires urgent medical assessment. Jaundice. Jaundice is another condition that can indicate distress in infants. It results in an overall yellowish hue to the skin, and it's caused by the buildup of bilirubin in the blood. While some degree of jaundice is common in newborns, severe or prolonged jaundice can have serious consequences, including potential harm to the baby's brain. Newborn jaundice occurs because the baby's liver is still maturing and may not be processing bilirubin as efficiently as needed. If your baby's skin and eyes appear significantly yellow, it's essential to consult with a healthcare professional for appropriate management. Section 5. Taking action. Your baby's well-being is your top priority, and recognizing distress signals is crucial. If you notice any of the warning signs discussed in this video, such as grunting, retractions, cyanosis, jaundice, or unusual breathing pauses, it's essential to contact a member of your healthcare team immediately. When to seek medical help. It's crucial not to delay seeking professional guidance and support when needed. In many cases, swift intervention can make all the difference in resolving the issue and ensuring your baby's health and safety. Consulting a pediatrician. If you are concerned about your baby's distress, don't hesitate to reach out to your pediatrician. They are well equipped to evaluate your baby's condition, provide a diagnosis, and recommend appropriate treatments or interventions. Remember, it's always better to be cautious and consult with a healthcare professional if you are uncertain about your baby's well-being. Preventive measures. While it's important to recognize distress signals, it's also valuable to take preventive measures to ensure your baby's health and comfort. Some general tips for keeping your baby safe and minimizing distress include regular checkups. Attend all scheduled pediatrician visits to monitor your baby's growth and development. Safe sleeping. Follow the guidelines for safe sleeping practices to reduce the risk of sudden infant death syndrome, SIDS. Maintain a comfortable environment. Ensure that your baby's room is at an appropriate temperature and free from hazards. Feeding and nutrition. Follow a proper feeding schedule, whether you are breastfeeding or using formula, to meet your baby's nutritional needs. Skin care. Be vigilant about skincare and hygiene, especially in preventing diaper rash and skin irritations. Conclusion. In this video, we've delved deep into the significance of grunting as an infant distress signal. Understanding your baby's nonverbal cues and recognizing signs of distress can make a world of difference in ensuring your baby's well-being. Remember, parenting is a learning experience, and each baby is unique. What's most crucial is staying attentive to your baby's needs and seeking professional guidance when in doubt. Your journey as a parent is filled with challenges and rewards, and we're here to support you every step of the way. Thanks for joining us on this educational journey into the world of baby communication and distress signals. If you found this video helpful, please share it with fellow parents, give it a thumbs up, and subscribe to my channel for more essential insights on infant care. Your baby's well-being is our shared priority, and together, we can nurture those precious little ones to thrive.